project has been around encouraging patient flow through various different ways, and so one of the ways was around enhancing the already created discharge lounge, which is an environment where patients who have finished their stay in hospital can be relocated while they're waiting for finalisation and or family to come and pick them up from the hospital, which then promotes the flowing of patients through the organisation.
We did develop an education program for the nurses, but we rolled that out to the wider multidisciplinary team to ensure that both allied health and medical, our medical colleagues did understand what the purpose of the discharge lounge was, but also what services were available down there for patients, so that patients could actually be moved down there earlier in their discharge process. The patients were appreciative of it being a much more welcoming, brighter space. Also, we implemented the New South Wales Health Mindful Packs for patients, which was a great resource for them to utilise to ease their boredom. And we've had another TV installed as well. We really have been prioritising a lot of work in that discharge space, and by putting the environment down there and allowing 8 to 14 patients at any one time to go through that facility, we've been able to unclog the front end and provide space in the right place for the person at the right time who needs us to start their treatment. So we've increased our occupancy, so we've been able to have inpatients down there but promote the flow. So 25 patients a day going through 14 chairs is actually really, really impressive. So it really is about enhancing the flow out.
There was a patient incident, so we got a multidisciplinary project team together, which included pharmacy, speech pathology, nutrition, nursing and ICT to look at some solutions. We developed a guideline that tested over 75 liquid medications to determine their thickness and to match those with the thickened fluids that we provide to patients. Where a liquid medication wasn't compliant, we looked at alternative medications that could be provided, and where there were no alternatives, we worked out a process for mixing those with thickened fluids. We developed 2 alerts in EMR at 2 points of care. So ultimately the guideline and the alerts work to prevent a patient receiving a liquid medication that they're unable to swallow. I think what was really key in this project, or what saw it being such a big success, initially was the leadership. It had really great leadership with clear actions and really timely actions as well. And the other key was bringing together the right disciplines, a whole range of disciplines with different expertise, each a piece of the jigsaw puzzle, I think, in solving the issue and making sure that we cover all of the clinical needs of each profession as well.
In clinical practice, especially with the EMR, there is a Swiss cheese model where there's all this information in the system and patients unfortunately fall through the cracks. Through this collaboration, it was really well thought out, a way to not be overly burdensome with our alerts, just to provide information for our clinicians to make an informed decision. And that's a really great outcome for patient safety.
Working on the team was wonderful. We each brought a different clinical lens to the incident and were able to come up with solutions to best alert our clinicians in the EMR of possible risk to our patients. I think the collaboration aspect of this project was its greatest success. The interaction between all disciplines in the team, in the project team, was unbelievable. I've never seen anything like it in the way which the respect shown, those core values which we all aspire to in our day-to-day jobs was demonstrated by all members of the team. This project demonstrates the first in state for alerting when patients are at risk with dysphagic diets. The fantastic thing is that it can now be scaled for use across all of New South Wales, and it's exciting to think that what we've piloted here at Central Coast is a solution which can be used to keep all patients across New South Wales safe in the future.
This project was about subcutaneous immunoglobulin administration home-based for patients to be able to do their treatment at home, based at Gosford and Wyong Hospital. We now have 2 community pharmacists on the Central Coast who are dispensing the product. And what that's allowed us to do is to continue the program for the patients, and it's great because the patients don't actually have to come to hospital at all now, even to pick up their product. They can go to the community pharmacy, and we've established some great working relationships with the community sector and effectively offset the immense burden that was on our hospital pharmacies. So it was an effective way to be able to progress the program. The collegiality and the relationships that we've formed with the other multidisciplinary teams across the hospital, and everyone worked towards this common goal. For some patients, this is an ongoing lifelong illness for them, and their whole lives centre around coming to hospitals every 3 to 4 weeks for very lengthy infusions. So giving them the option to be able to do this at home gives them a lot more autonomy, a lot more freedom. We have patients now that are travelling, and it just allows them that option to have more control over their condition.
It is life-changing for these patients, because to have IV immunoglobulin, they would spend somewhere between 3 to 6 hours. We have had patients that have been here for 8, 9, 10 hours, depending on the dose that they're getting. But some of these people are doing it, twice in the month. Some of them come for a while, come weekly. So it really takes a chunk out of their life, and it's a huge lifestyle imposition when you've got children or work, or even just for the older people, they can't go anywhere or do anything. So it's been really positive. And they've really, really accepted it and like doing it. And I think that's a really big positive for the hospital and for the staff.